So as Claire alluded to, I'm absolutely thrilled to introduce our first speaker for the day. It's really an honor, I think, for me to get to introduce Jacquelyn. So Jacquelyn Favours is the Director of Community Engagement for the national nonprofit organization Health Leads, where she works at the intersection of healthcare and health equity, aiming to ensure every person has the ability to achieve health with dignity. Jacquelyn graduated magna cum laude from Fisk University with a bachelor's degree in biology and received her master's of public health from Tennessee State University. She has over 7 years of academic, community engaged, and health disparities research. Jacquelyn has served as the co-chair of the NAACP Nashville Branch Health Committee and as a mentor for the TN Achieves program and as an ambassador for the nonprofit Black Ladies in Public Health. We are also incredibly lucky at THCC to have snagged Jacquelyn to serve on our board of directors and also as the co-chair for this conference series. Thank you so much for presenting today, Jacquelyn.
Thank you so much, Margaret. I really appreciate you and also the Tennessee Healthcare Campaign for having me here today and inviting me to speak on what health equity is. And I'm definitely excited to share because this is my wheelhouse and public health gets me all riled up. And just hearing you talk about my background, it's funny because of where I'm going to start off today. But yes, I am a public health professional through and through. And as a public health professional, I make the health of communities my business. And before I do that, next slide, please. I do want to start with a story. And who you've seen before you today is a little girl who had dreams. And if you don't recognize her already, it's me. But this young girl had dreams of equality. And if you would have asked this young girl who's about 5 at the time what she wanted to be when she grew up, she would have said that she wanted to be the leader of the free world. And some may chuckle at that, but as a young girl who thought and believed in the ideals of American ideals of justice, liberty, equality for all, I really did believe that I could grow up and do anything I wanted to do, be anything I wanted to be. And fast forward a little bit, a few years when I was in high school, I had a math teacher actually that gave me a very important assignment that taught me, and very timely assignment that taught me a lot about life. And the assignment was to figure out a couple of careers that we wanted to do ideally. And luckily through that time, every time I told someone I wanted to be the president, everyone always said, no, you're going to be a doctor, you're going to be a doctor. So at that time I decided, well, I'll look up what does it take to be an MD and what would it take to be my next favorite thing at the time, because I was really an admirer of my math teacher and his ability to teach. I thought I would look up being a math teacher. And it was at that time that as I began to look up, and if you've ever looked up the difference between income, years of schooling, there's some differences there. And it was that time in my mind that I realized 2 jobs that I thought or held fairly equal to myself were actually not seen equal at all to the world. And so fast forward a little bit further to the time when I'm about 22, I found myself in unfortunate circumstance. And like many of my classmates, which I felt was kind of weird, we were struggling with finding access to healthcare. And I found myself without healthcare insurance. And oftentimes I saw my classmates relying on local clinics, having to pay co-pays. And if you know anything about being a student that doesn't have much support, you don't really want to pay for many things because, and especially going to the doctor, because going to the doctor meant money. And if anything, we would just try not to get sick or hold off a little bit longer. And as as a student that was working part-time, trying to survive off a work study, I definitely wasn't trying to go to the doctor and didn't have the ability to afford healthcare, and fell into this gap where I wasn't supported by other resources or other means of getting healthcare. And so I believe it was really at that time that those lessons all kind of piled up for me and taught me my next point, next slide, please, which is about equality, the difference between equality and equity. And what you'll see here is a image that you've probably seen many times in maybe you haven't, but it's often used in the public health world to describe the difference between equality and equity, because it shows three individuals that are watching a baseball game over a fence. And what's more American than a baseball game and watching it over a fence, right? So this picture actually shows on the left-hand side equality and what equality looks like in this particular context. If every individual is given an equal box, they don't have the same access to watch the game. Whereas if they're given on the right hand side boxes that fit their situation and fit their needs, everyone's able to access the game. And so that's the thing that that's the point that I want to make here about equality and equity. When we're working from a point of equality or from a lens of equality, saying that everyone deserves the same thing, we're giving them exactly that. And we're also assuming that everyone is starting from the same place. And the difference there is that with equity, we realize that everyone doesn't start from the same place in life. And sometimes there's a need for us to give more or a little less, depending on where people are starting. And an example there is going back to my story. As I was an adult, not able to afford health insurance, again, I was falling into a gap where there was equality of things, where there was healthcare insurance, there were resources out there, but I was not able to access them because of equity issues. And I want to go to the next slide. So talking about health equity and what's this whole thing about health equity, and I'm showing you another image that takes another situation to demonstrate equality versus equity. But also I want to describe to you the idea of health equity. And health equity is a term that began to be popular because it described what was possible when we didn't have disparities or inequalities or inequities. And so I describe health equity as the goal or the vision for public health. We want a world that sees equality as possible, that aims for equal opportunity and makes sure that every person has the opportunity to access health. And in the image, it shows you that every person on the top layer doesn't start at the same place because every person did not start with a disability. And this individual on the right-hand side you see is in a wheelchair and unable to ride a bike. And what we know is that we have enough resources and technology today for even a person who may have be physically disabled to be able to enjoy the pleasure of riding a bike. And so through addressing those things, what are the social and environmental things? Things like income, what neighborhoods we live in, education levels, those things are actually predicting what our health outcomes are. And with health equity, this shows that we want to change those things. And it's really important for us to know what causes health in the first place if we want to address those things. Next slide, please. And so in the next slide, we see that you see an individual, and we see that there are multiple things that contribute to an individual's health and a community's health. And so I have the tagline there that social and environmental factors determine 40% of an individual's health. And it's actually 50% as we go through this diagram, you'll see. But on the top half, you'll see that there are social economic factors like I just described: education, job status, family, social support, income, and community that makes a difference in whether a person is healthy or not. Those things not only determine a person's health, but they also determine how a person will interact with the healthcare system as well. And so looking further down, if we go down below and look at the healthcare piece, you'll see that that contributes 20%. And so when we think of all these things together, social economic factors, the physical environment that someone is in, the neighborhood that they're living in, the city that they're in, the zip code that they live in, and also healthcare access, those things begin to add up, and we realize that it's not just health behaviors that contributes to a person's health outcomes. And for so long, I think in public health, we focused on just trying to get people to make the right decisions, and we were wondering what's not working. And we realized that there are these forces that are coming against, and I think more clearly now, by the injustices that are happening in our society, that there are these forces that push back against an individual's health, even if they are attempting to make healthy behavior choices. And some of those things keep them from making those choices. And I want to dive a little bit further into social and economic factors and the environmental factors quickly, and just provide an example. And so you see here the social economic factors again, they're just blown up. And this is an image from Blue Cross Blue Shield. But I like this image because it really simplifies the 5 categories of the social environmental factors that are determining our health. And I can go back to that example of being a student, being a college student with a part-time job, not being able to afford health insurance. But I can also provide an example of a father who may live in Tennessee and have to commute long distances to work and may have a chest pain or some pain come up in their body and not really feel like it's a priority because of the other issues that they're dealing with, such as work priorities, family priorities. And those things tend to keep us making different health choices. So instead of going to the doctor, that individual probably waits a little bit longer and that health issue worsens. So that's just another example. I could also talk about having living wage, the rate of cost burden in urban areas, having stable housing, reliable transportation in rural areas, and many, many more examples that contribute that are to these different categories that are listed here. But as I'm saying, the point I want to make here is that these social economic factors drive health in a positive or negative direction based on whether or not they exist. Of course, for individuals who are able to take these things for granted, they don't have to worry about whether or not there's a park in the neighborhood that's safe for them to play at or to take their kids to play at. Not worrying about whether or not they would miss pay by going to the doctor. And those are things that are causing people to continue to struggle with their health and continue to struggle managing their health. And because of that, we know, next slide, that instead of health equity, what we actually have are health inequities. And these are the things that we are working against. As mentioned here in the definition, excuse me, health inequities are those things that are social and economic, like I just mentioned, but they also are systematic and they are avoidable and unjust and unactionable. And they're due, as we know in this country, because we didn't all start off at an equal place. And in our country, certain systems, in particular health, was set up in a way where there was an unequal distribution of resources to begin with. And because of that, that cycle continues to make the inequities systemic. And again, going back to the things that these are the things that people are unable to grasp, even if they are making the right behavior decisions or behavior choices, they're unable to access these things because of the inequities and unequal distribution of resources. And next slide, please. And so it's, again, I think it's really important that we talk about this definition of inequities and call out inequities directly. And that's what it means to be leading with a health equity lens. And when we address these systemic inequities that keep us from having a healthier community, we'll be able to make action. And so again, going back to this slide, and you see the tree that I have here, it's a barren tree. And this is what the systemic inequities continue to make our society into a cycle of like a barren tree that is not able to produce fruit or make progress on health equity because of these systemic issues. And as I mentioned before, by us being able to identify these issues and call them out specifically and acknowledge that we are not all starting from the same place when it comes to health and the different the different determinants that go into our health outcomes, we will continue to be in the health statistics that we have now. Tennessee is a state that's very unique because it is a mix of urban and rural, but we have a high number of rural individuals that live in low income situations or environments that are under resourced. And because of that, there's systemic issues around living in a rural area. And those things we have to acknowledge. And if we don't acknowledge those things, we continue to be in the 40s on just about every disparity that you would list, or that a health professional would list. Tennessee would not be doing as good as it could possibly be doing, and definitely not on par with national. So we want to go on to the next slide, because you're probably wondering, why do all these things matter? And why it matters, again, is because we want to move forward. Once we're able to acknowledge what health equity is as a collective and as a whole, we're able to get over differences. We're able to advocate for vulnerable communities. We're able to support equitable policies and fully understand the common goal that we're all working towards. And so some of the things that I've listed here are healthier policies, healthier communities. If I was to ask anyone here today, I'm sure that if I asked you if you wanted better healthcare, you'd probably say yes. And I could guarantee you that if we as a whole, as a community, as a state, and Tennesseans, if we work together to have everyone understand the common goal for health equity, then ultimately there will be an altruistic effect that everyone in the community would be able to have an improvement in their health care. And so I also mentioned here less suffering from peers and family. And I mentioned that specifically because of COVID. And I think that that's what shined on us so much in 2020, is that because we continue to have the same systemic issues that we state that we might be addressing, but don't put action towards and come together to work together as a community, then we continue to see that individuals will suffer when there's a crisis. Our peers, our family, our friends, and hopefully not, but quite possibly could be ourselves. So when we do this, we're able to create change. And just going to the next slide, I bring back up this image of health equity. And you see in the third panel that the fence is gone. And so I bring up this image and want to leave with this image because I started off with the story of a little girl who was dreaming and had a vision of something. And the story and the tagline here says, don't just tell a different version of the same story, change the story. And so what I would want for my future and for the little girl that was coming after me is to not tell a different version of that same story, but to be able to change the story, that we all have equality, and equality through achieving, I apologize, we all have equality through being able to address inequities. And as you see in the third picture there, who knows what's possible? We might even remove all the barriers to allow everyone to have access to the game. So I will stop there and take any questions.
Thank you so much for that presentation, Jacquelyn. If there are questions for Jacquelyn, please put them in the chat box now. Jacquelyn, I was wondering if you might talk a little bit about what you think it would look like for us to do this, the way you're talking about focusing more on health equity, and what it would look like in practice for people. And I feel free to answer that on either, a systems level or an individual level, what people in the conference can do to think about how health equity would affect their lives.
Right. Well, I talk to a lot of health professionals, so I'll try to address it on like an individual level or a more local community level, and also at a national level. And I think that on a more individual level, we need to be more understanding of what communities are going through. Oftentimes, when we're trained, just like I was when I was in high school, I was thinking that I was trained to see certain things, but those things aren't always the most important things. And sometimes it just takes one person asking you the right question for you to fully see what's most important. And I think that sometimes as people that are helping navigate folks to different services or helping provide services to individuals, we might sometimes question why they're in that situation or why they're not doing what's necessary for them to have better health. But I also think that we need to acknowledge what has happened to individuals and the point at which they started from to get to that point in order to help us be better providers of care on an individual level. I think on a systems level, we have to be very specific about when we're writing policies, when we're writing rules, about who we're addressing those things for. As you see in the fence image, if we give everyone the same thing, if we provide equal policies, then those policies are not going to be what everyone needs. What we need to be doing is providing equitable policies. And the way that we get equitable policies is that we begin talking to, we begin engaging, we begin getting to know those vulnerable communities that we're drafting policies to help. So I'll stop there.
Well, thank you for that answer. I think there are two related questions here. Barbara Clinton asks, is there one particular aspect of health outcomes that particularly troubles you in terms of lack of equity? And I think this is a related question too. Jose asked, how does the US fare on health equity relative to other industrialized countries?
Okay, well, to take the first, well, I'll answer Jose's question first. But Jose, you might know and others might know, the United States does not fare too well as it relates to other countries because of the amount of money we spend on healthcare. And that's that's a whole nother can of worms, of course, but the amount of money that we spend on healthcare, if we were actually making progress, it should seem that we would have the best care. We wouldn't have anyone suffering at all. But we actually have quite a high spending in our healthcare system, and in compared to other countries who are spending less and even in some instances providing healthcare as a birthright or to all citizens of their country, they have better health outcomes, of course, because individuals are not worrying about that initial encounter with the doctor, right? They're able to go and get primary health care. Of course, they have to pay for specialty services, but I think that the ability for individuals to have that initial access point, that primary care visit, is very important. And so I guess going into the second question of, is there one particular piece that really troubles me? I think it's that piece. It's the fact that people can't wake up or even be born and just know automatically that they have health care or they have access to quality health care, and that in our country it's more about having to have money or having to have a certain social status to be able to get quality care. And so that really sends a bad message to individuals who don't have money. It tells them, you know, you shouldn't get sick. But we know that that's not the case. People will still get sick, and we've seen that with COVID.
Thanks, Jacquelyn. I think in the interest of time, I'm going to move on to our next speaker, but if we have time a little bit later, maybe we can circle back to Tony's question.